Okay. I was told that once we hit about 500 participants that we can get going, so we'll go ahead and start. It's pretty incredible to think of all of you joining us, and I'm really grateful for you spending time with me today. I'm Megan Pugmire. I am coming to you from Portland, Oregon, where I'm a creative director at an academic health center, Oregon Health and Science University, where I direct the brand strategy and design team within marketing and communications. This is our beautiful state. This is our campus where we only have essential workers right now. We're in modified operations, but we have about 17,000 employees, many degree programs, research, and that sort of thing. So this is the institution that I support and do work for on a daily basis. So our objectives today are 3. And the first one is we're going to learn how to lead a group of stakeholders in a creative discovery. We're going to talk about developing a creative strategy brief, and we're going to determine a realistic multi-channel implementation plan. So one of the things I want to talk about is how much things have changed. When I started out the year, I didn't realize that in March, very quickly, all of my work was going to pivot from everything that we had scheduled to being entirely COVID-19 focused. So this PPE document here is an internal document that we worked on for employees that I think is on version 30 something at this point right now. On the right here, you can see our signage. We had to completely rethink how we explain to people how to be on our campus, what to do if they had to come for an appointment. Our visitor policy has changed many times. Social distancing became a thing. The way that people used elevators, many things. And so all of a sudden my job was really radically different, and the things that I normally focused on changed. So from the time I submitted my proposal to this conference to now, it feels very different. We've been pulling together resources for Oregonians on COVID-19. Because we're the only academic medical center in the state, we know that we're looked to for trusted information. So we've been constantly updating content on our COVID-19 site so people could have information. We also immediately after this, once we started to get a little bit of a handle on our COVID-19 communications, realized that there were going to be some financial implications for our employees. And so we pivoted really fast to communicating about budget changes and what that means for our workforce and how we're going to support people. And this meant a salary reduction, and how do we explain that in a way that helps people feel comfortable about the future. So we created videos and handouts, and this is a deck we made for managers to help them explain the financial implications of COVID to our employees. All of a sudden, we had to support virtual visits so much more than we had before. It had been a very long project that we were going to be developing, and instead we had to do it immediately, as fast as we possibly could, and explain to patients how to do it in a clear way that they could understand. We also needed to help Oregonians understand the importance of staying home. So we launched a campaign basically over a weekend with the governor's team to help Oregonians understand they need to stay home in order to save lives, so we could flatten the curve and not overwhelm our healthcare system. And that's since been, as the state began to tentatively reopen, changed to this Oregon Forward campaign as well. All of these efforts had creative discovery behind them, except for the first one with our COVID-19, because we were moving really fast. And then we worked with OHA, Oregon Health Authority, to translate these statewide communications into 11 different languages. And then there became unrest throughout the country over racist inheritances and policies, and OHSU took a stand on that, and then we pivoted to talk about these really important communications that obviously have huge public health implications. So again, from the time where I was going to talk to you about creative discovery in one sense, so much in the world has changed, and the way that I think about creative discovery itself has really changed as well. So I feel like that context is really important. I'm always trying to develop the way that I work and use creativity to meet us where we are. One thing that's been encouraging from my perspective is that clear communication has never been so valued. I see our emergency operations committee understanding that the clearer we can communicate about things, the better for our staff, for all OHSU members, for our patients, for people across the state. So for those 3 objectives, I'm going to use this Key to Oregon study as a case study that we're going to use to illustrate our points as we move through today. And this is a study that OHSU launched to help understand the occurrence of COVID-19 in Oregon. And I'll tell you a little bit more about that as we move through. So baseline, when we need to start a campaign for whatever reason, there are 3 things that need to happen before we get to a creative discovery. The first thing is that data has been gathered. Whatever kind of data is available to you, that can be qualitative data, it can be quantitative data, but it should help you make decisions about what your strategy is going to be and then set goals for that strategy. So for example, our data, because this was a partnership, this Key to Oregon study between OHSU, the OHSU PSU, which is Portland State University School of Public Health, and the state of Oregon's Oregon Health Authority. We took data from our team's research, from epidemiologists, from all sorts of different places. And then the strategy was then to better understand the prevalence and transmission patterns of COVID-19 across the state, conduct a statewide study to track, test, and precisely map the virus in real time. So we knew that our goal then was to enroll 100,000 randomly sampled Oregonians representative of state demographics. Some of the research we looked at, this is market research from a marketing perspective, but one of the things that was really interesting for us throughout this crisis is that local healthcare experts are the people who have been most trusted to deliver information about COVID-19. And so we knew that we had a responsibility to communicate as well and as clearly as we could. We also had all of the data that the Oregon Health Authority is constantly gathering and that's available for public viewing. And then we also knew that their social disparities were showing up in COVID-19 numbers as much as they do in other areas of health. And we knew that there were inequities present and that they needed to be addressed. So then it's time to move to creative discovery because we have our data, our strategy, and our goals. Now we're ready to talk about the creative. And the way that I do this is when it's in person, which I haven't done now for a few months, is that we arrange chairs in a way that facilitates conversation. Often we could be in a conference room or a classroom, and we'll spend some time, get there earlier, rearrange the chairs so that everybody feels like they're there to talk to each other. We want to make sure you have good markers. Those are really important. Everybody needs to see what you're writing, a working eraser and a clean whiteboard. And then sometimes I use those big Post-it easel papers if I don't have a room with a good whiteboard in it. And if I'm using a whiteboard, you want to make sure that you have someone there to take pictures before you erase. And you want to double up on that just in case you drop your phone in a puddle or something like that once it's over. Virtually, the way I've been doing it is sharing a screen. And then I have myself or an assistant type in a blank document so that people can see the discussion unfold on screen. And then someone needs to monitor the chat as it goes through. And I tend to do that myself. I'm able to do both, or I have an assistant bring the chat through as well. It's really important to invite participants with a wide variety of applicable expertise. And often we want to make sure we're including the people we're trying to serve. If they are not employed in our organization, we want to make sure that also that they're compensated for their time and their contributions. And then when you have that 2-hour session, make sure you schedule a follow-up meeting as well. I know 2 hours seems like a long time. I have never not used it. It's really important that you are able to talk all the way through these questions. I'm kind of a believer in short, like 15-minute meetings where you just make a decision and get going, or longer than an hour where you really get to talk all the way through a problem. We've noticed that that's been just so important during these COVID communications for us, especially when we're not seeing each other in the office every day. These are some of the ground rules that I share with participants. The first one is to be present. This has been really hard virtually, I have to admit. I ask people to stay present, be on camera, avoid multitasking, but very often they're checking their email or answering questions on Teams, and I can see people do it, and I don't tend to comment on it, but it does take away from the discussion. It's really important that people are present and contributing and thinking about what other people are saying. In person, I ask for computers and phones to be put away. If someone has an emergency, we know our providers have pagers, for example, they can leave the room. But there's signals sent by how much people are engaged. We also try to avoid hierarchy. All contributions are needed and valued. I noticed when I started doing these that often people would defer to someone in a position of leadership. And so I try really hard to bring people who may be quieter into the conversation and to make sure that people who are used to speaking out understand that they can step back a little bit and give others a chance. That's what step up, step back, our number 3 means. If you're used to stepping forward, make sure you're taking time to let others take that chance to contribute. And then we ask that people practice respectful listening. That can be difficult in virtual environments, but chat often helps with that, incorporating the chat into the general discussion. And then I often pause here and ask if participants have other rules that they would like to add. This is meant to be collaborative, and if someone has something they feel is missing from this list, then we will add it and agree together to follow these. So the creative discovery itself is 4 questions. The first one is, who is our audience for this campaign? And believe it or not, that takes 45 minutes to talk through. There are a lot of questions that have to do with audience, and the people in the room will have, because they are the audience or because they have expertise with this audience, will have a lot to contribute and talk about. And it's really important that we delve into the nuance of our audience in order to address them well. The second thing is the primary goal of the campaign, and that usually takes a little bit less time. Same with the key message. And then the 4th thing is how we want people to feel when they encounter a campaign. And that is what I call our descriptors. And I know that that seems kind of loosey-goosey, but I feel like that's a really, really important question. And I went to, was it Dr. Lucy Jones's presentation yesterday about science communication, and I really appreciated what she said about storytelling and how we get science across. So here's an example of what this looks like on a big Post-it easel. This is a conversation we had with our education team where we're thinking about how to talk to our prospective students. But you can see I'm just writing here, and very often we'll fill several pages. But it's really helpful for people to have the conversation there to refer back to. And then this is an example of what it would look like in a web chat. I usually just pull up Word and try and just type it out as we go through. Sometimes if a computer is loud, the typing can be distracting and you'll have to kind of toggle back and forth between mute. But no, my computer tends to be a little bit quieter, so I'm able to type and facilitate at the same time. So if you are the facilitator for the discussion, it's really important that you keep the conversation robust. One of my favorite questions is just, or I guess asks, is tell me more about that idea. Tell me more what you mean by this. Tell me more about how you feel for that thing. Tell me more about that experience. Tell me more what you know about this person. Or do you have an example you can share with me where you've seen this idea with your audience, that sort of thing. Just always keep those questions coming. Another example would be, what else do you know about this audience? Or if we had to narrow that goal into one action, what would it be? So that you can really zero into a primary goal. What's one thing you want people to walk away remembering when they see this campaign? That's a good question to get to the core of a key message. And then I'm constantly resetting. So people will very often have a tangent to go off on. You know, they might want to talk about getting into tactics already. Like, I think we should do Facebook posts, or can we do a video about that thing? But we're not ready to talk about the tactics until we have the creative done. So then that's when we bring the group back and we're just focusing on these 4 questions for this discovery. So that's the reset. The restate is, I think what I'm hearing from you is, right? And making sure that we understand people's ideas so that we can share them appropriately. And then simplify. Very often we'll have jargon, and I'll try and get people to restate their ideas in plain language, because we don't want to bring that jargon to the audience. I know everybody here is invested in that. It can be hard. I'm not doing a good job here of looking at your Q&A. Let me see if there's some things here we want to talk about. I am doing the process in Zoom, and it's usually just me because I'm used to it, but you can use 2 people if you're new to it to help facilitate. The difference between the goal and the key message is that the goal is what you want the campaign to accomplish, and the key message is the one idea that you want people to remember as they come away. And I'm going to show you the key to Oregon so you have an example. The idea of enforcing respectful listening, if someone is trying to shut down or dominate the conversation, I will pull back to the ground rules. That's why we established them in the beginning, and say, so-and-so, thank you so much. I feel like we've heard from you. You know, Mario, can you tell us more what you're going to say? You were interrupted, or that sort of thing. I use that ground rule as something we all commonly agreed on so that we can refer back to it. Oh, and then Janice is saying keyboards can be silenced. Awesome, I would love to know how to do that. Thank you for telling me that. And the difference between the reset is bringing the group back to the 4 questions, and the restate is taking someone's idea and saying it back to them to make sure you've interpreted it correctly. Okay. So it's really, really important to just keep everybody talking. Bring all your curiosity just in your head. Just think that this is the most important conversation you've ever had in your life. And it takes a little bit of practice to get used to both facilitating and asking questions. So if you feel like you need someone to type or write while you facilitate, that's fine. It just depends on how much your brain is able to do those things at the same time. It just takes practice, but just keep everybody talking and just really dig into those questions. So the hardest part is that every question has to be answered in 1 sentence, and everyone has to agree on what that sentence is. And so you just keep facilitating. And it's important to do this because that nuance is always really fruitful. People will get stuck on 1 word, and that 1 word will mean a lot in terms of how you're talking to your audience or what you think your key message is. And so that consensus means a lot. And once you get there, you're going to move forward with such a better sense of everybody being on board than if you leave something undiscovered or unprobed. And I always look for what I call the switch. I don't have a little trademark on here because I haven't trademarked it yet, and I'm not going to, of course. But the switch for me, there's always a beautiful moment where the audience becomes the focus. So often we'll start off talking about an audience by referring to ourselves. Well, I want to tell the audience this. I want the audience to know that. This is what I think it's important for them to know. And at some point, there's a switch where we start talking about what they need, what they're asking for, what they want, and not what we want to tell them. To me, that is when the creative discovery locks into place. It's user-focused, it's working on what the audience wants for themselves, and for me, that's the most beautiful part of this whole process. So look for that. There's always a moment. My mom, my parents live in Seattle. My mom can hear the tide turn. When they're down on the beach, she can hear the tide switch from ingoing to outgoing. I can't do it, but I think that's amazing. And for me, that's what the switch is. It's like, okay, we're focusing on what we need to be focusing on. If you sense hesitation in a member, and this is harder virtually, this is something that I have struggled with, just to be really frank, it needs to be unpacked all the way before moving on, because those are the people that you will lose and their investment in the process after this will be lessened. So if someone is being extra quiet or they seem like they disagree but they don't want to say it, I'll try and gently pull out from them what they disagree with or what they feel isn't being heard. So again, going back to those ground rules. And then every time that question is finished, so once audience is done, I'll write the audience agreed upon 1 sentence on the board in the corner, so that the whole rest of the time we can refer back to what we all agreed. We all agreed this was the primary goal. We all agreed this was the key message as we keep moving forward. Okay, I'm gonna check my Q&As again. Oh, this is a really good question. Brianna's asking, brainstorm sessions can be incredibly overwhelming and counterproductive for introverts. How do you accommodate for introverts while making sure you meet your goals? That's a really, really good question. So I do feel like for introverts, the virtual session can be helpful because there is the chat, and often they're more willing to contribute in the chat and then have those ideas read out. In terms of in person, I'll often notice that they're there and I'll kind of ask them questions if I feel like they're going to be comfortable with it. Or I'll say, if you have feedback, you know, you can tell your partner and the person you joined with, and they can say it for you, or they can give me feedback after the session. That's a difficult one. I would love to know your thoughts. Post-its is somebody's idea. That's a really good idea. I'm gonna have to take that. And then, do I have suggestions for scheduling in a virtual environment? Do I try and limit the number of attendees? I have not for either, and I have found it to be okay. We just did a big discussion with about 50 people, and so far I haven't had there be too many. That's a good question. For introverts, have everything right on cards that get passed up or hand out Post-its for answer writing that can be posted on a whiteboard, from Amy. Thank you, Amy. That's really helpful. And then Leslie says round robin helps that all voices are heard. That's a really good idea too. Generally, I know the people in these conversations, and so I think that helps me a little bit. But if you're doing it with people you don't know as well too. Janice is asking, how do you politely silence the extrovert who insists on responding to everything? Again, going back to that ground rule, but then I'll also just say, thank you, we've heard from you on this point, I'm gonna move on to this person, and then I'll bring somebody else in. And then how do you facilitate open conversation when there's a hierarchy of roles? So I try and establish from the very beginning that this is a process without hierarchy. I know that can be a hard thing to overcome, but again, it's your job as facilitator to ensure that those that all voices are heard equally. Let's see, Brown is saying, give introverts time to think before the meeting so they can come prepared and their thoughts are organized. Pass the agenda goals onto them beforehand. Have them partner, both can be heard. Questions in advance. With the hesitation piece, how far do you take this before it is more advantageous to move on and then come back to an area of hesitation as a group? I never parking lot. I just keep asking questions until we've all agreed. That's a good question. Sometimes we've run out of time, and that's the only time where we haven't finished it. Someone anonymous says silence can be information too, and I agree with that. I just really try to establish an atmosphere of trust and openness. And sometimes it'll take the first 30 minutes for people to get warmed up. But I try never to move on unless I feel like everybody has been heard. Someone says sometimes they deliberately avoid eye contact with that extrovert and gently ignore them and give them, yeah, I have done that too. That's good advice. And then how do you deal with groupthink? That's another really good question. So many good questions. That's where you unpack and say, I hear maybe an assumption in this statement, or can we look at it this way? And is there a different road that we want to explore here? Like, we could say, maybe we've thought about this perspective. What if we all step out of that and step into this one and tell me how that feels? That kind of thing. It takes practice. Okay, whoops. So always in the end, this is my favorite part, someone will say in a surprised voice, that was fun. A lot of times, especially, you know, I work in an AMC and most of our people are fairly literal, and even though we explain what to expect, I don't think they really know, and it can be a little bit scary, honestly, but eventually everybody warms up, and then they're excited, they had fun. We even did a topic about harassment in the hospital and how to communicate about that. And even that is, I don't know if fun is the right word, but it's engaging, it's a challenge, it's a new way of thinking, and it's another way to interact with people that you don't normally get to do. And then now I hear people say to me, well, we can't move forward without a creative discovery. And that's my favorite statement, because people realize that consensus, that thinking through a problem is really important. So what I believe creative discovery does, and that I have seen over and over work, is that it gives people time, like I said, to talk all the way through a problem, collapses that hierarchy, It establishes and deepens relationships and collaboration. I often have people say, like, I didn't know about that person. I didn't know that they felt that way about that thing or thought that way about this thing. It builds consensus at the beginning of the project instead of trying to always wrestle it out of people the whole way through. You gather it together in the beginning. You demonstrate the work of the creative process. If you are a professional creative, you know how hard this can be, that your work can be dismissed as decorative rather than a really integral part of problem solving. And to me, this helps people get what we do and why. And then it forces, again, that clarity of communication. So for Key to Oregon, Friday night, I got a phone call. We might have to support this study. On the weekend, we had a quick team touch base. Monday, we talked to the data and the strategy. We had a creative discovery scheduled for Tuesday morning from 9 to 11. And we had our dean of our School of Public Health, our principal investigators, cancer research leaders who had been working on some community engagement that we wanted their expertise, our ITG team, a bunch of different people, our community engagement liaisons who were in place for another project. So it was very quick. And I'm going to talk a little bit about some of the mistakes we made at the end of this so that we can talk through them. But that's what happened. So then we move on to the creative brief once you've answered these questions. So I'm going to kind of go through. If the switch doesn't happen, is Shirley's question, that's okay. Just keep moving ahead. You can try and make sure you're talking about the audience, what they need and want rather than what you want to show them is one way of framing that. Some thoughts on creating a discussion board for the conversation to continue post-meeting. That's a lovely idea. I've never thought about this. It can be a platform to guide someone toward who may be monopolizing the conversation, an introversion opportunity. I had not thought about that. Brainstorming about sensitive topics is a question. People who may not have had sensitivity training. I feel like that's really the job of the facilitator. And part of that is your ability to reset. So often I will say, thank you for, bringing this up, but we're going to move this way. Or one of the ways that we try and change our language when talking about that is by using this language or that sort of thing, kind of try and, but that's also what the ground rules are meant to do. Ensuring good representation across stakeholder groups in the target population is that we will often ask for recommendations for people. Like, I need people in a variety of roles from your team who will bring their full selves to this process. And we often get a really great wide variety. One example I can think of is we did some EPIC communications that I'll show you a quick example of in a second. And we had about 50 people from across disciplines like informatics and nursing and PAs and all sorts of things. And that wide variety was really, really great. And they had been recommended by people who knew that they were people who would show up and really contribute. Do I ever use concept maps? I don't know what that is, T. So I will have to, I would love for you, Douglas, I would love to hear more about that. Extroverts have a need to express themselves. Ignoring a person who may be an extrovert is hurtful. Oh, that's interesting. I have an extroverted teenager. I understand what you mean. Again, this is practice that comes with facilitation, is just knowing how to navigate different personalities. If someone responds offensively and doesn't follow the ground rules, I have never had that happen so far. I think if somebody is disturbing the session, I would probably ask them to speak in the hallway with me and reiterate those rules. And if they weren't able to follow them, I would ask them to maybe not stay because they were sabotaging the session. I've never had that happen. That is something I can think through. Let's see. I said that I don't call people out when I see them multitasking. I will sometimes say, I just want to remind everybody that your presence is important. I will say that. And I often give a 5-minute break after the audience. And then I'll say, feel free to answer your text or check your email. And then I need you to come back and be present again. So it gives them a little minute to do it. I know people are busy. Someone said, Krista says, Mural creates a really nice platform to allow people to add into one mural or discussion board simultaneously. Thank you. Okay. What platforms do I use other than Zoom? We use WebEx. That's our platform for OHSU. And so that's what we've been using. And then how do I choose your groups? It's very topic driven for the most part. So for patients, we'll get recommendations from staff for people that they know will be engaged or that have needs that we really need to hear about, I think is really important. We did a creative discovery for our Center for Women's Health, and we were talking about patient experience. And one of the patients they invited had a husband who needed a caregiver. So she had been both a caregiver and a patient, and her perspective was just invaluable. It was really great to have her. And so oftentimes our staff, they know who should come and who's going to give us rich feedback. Douglas, Dr. Coyle, thank you for that recommendations about concept mapping. I'm definitely going to check that out. So when we get to the creative brief, I'm going to move a little quickly here. You have your answers to your 4 questions. And then considerations about pertinent context for your campaign. I'm going to show you what this looks like in a second. And then you're going to have your creative concept. So you've taken all this information that's been given to you and you're going to come up with your campaign. And then your mood board is a touchstone for the feel of your concept moving forward. And then the application, if you have time, helps literal minds know what to expect. Oftentimes you can come with a creative concept and then they're like, well, what does that look like in real life? And so I found that if I have time to pull together a quick application, that's really helpful. So considerations are, what are the things you need to make sure you address in this campaign? And I'll just kind of keep a running list as I'm working through this. What do I need to address or be aware of? What context is important? And then I always have somewhere to write down when I have creative inspiration, because it's never going to come back the same way identically. Never. It never does. You might think you're going to remember and you're going to miss the nuance. So make sure you have somewhere to write things down. And then find where you do your best creative thinking. Mine is on a big sketch pad on the floor with a Sharpie, and I need to be quiet or have some just rumbly white noise. And you may be struck by a bolt of lightning, have the best idea from the very beginning, or you may struggle, wrestle, and have 3 different ideas that you want the group to discuss. And that's all fine. The creativity part, it happens in different ways for each campaign, and I think that's normal. So one thing that you want to make sure and do is trust your mood board. So you can see here, I do all my mood boards on Pinterest. These are some examples of things I've been doing. I just have them private. You can have them public, I guess, if you want. But what a mood board is just a visual reference that gives you a touchstone for the feel. Like, this is how I want this thing to look and feel for me. It's not literal. And sometimes I have to explain to people again, like, it's not going to look exactly like this. It's like if I took all of these pins and put them in a blender and blended them up and poured it out, that's the essence of my campaign. That's how it should feel. So here's an example of that. This is a mood board I had we're launching new Epic capabilities that are way better for patients. But for staff, it's really hard to change their workflows. And they had all these crazy workarounds. It was like this big mess. And so it's all been simplified, but people have to be on board in order for the change to actually happen. This was our mood board, and then this was our campaign. And this came through as a creative discovery, like I said, with about 50 people. And it's been really successful. And the whole idea was you're missing the full picture. You're not getting this robust sense of your patients that you need to have. Who are they as people? You need to have that full clinical portrait. But you can see here, this is not exactly like this, but the essence of it has been captured. So have fun with your mood boards. And then try and show, don't tell. When you come into the pitch, and this is what your 60 to 90 minute second meeting for, is to present your ideas, you want to make sure and show and not tell. So this is an example for a graduate medical education recruitment campaign we're having to do because people can't come to campus now and see if they want to be fellows or residents here. It's really difficult. And so we're doing a campaign based on the senses. And this was me pulling together what a still photography sense board might be like on social media and Instagram stories. I went to graduate school in theater, of all things. And for me, the smell of a theater when it's empty, right? Imagine this right now. It smells like dust and carpet and curtains and wood, paint, depending on what your set is. There's a particular smell to the air in a theater. But then a full theater is people with their perfume and their shampoo and their deodorant and their popcorn or whatever. And all of a sudden it's full of life, and they're there to engage with you in your art, in your play. And so for me, that sensory experience of a full versus an empty theater is very rich. So I pulled this together to show our community that we're pitching to, so that they got a sense of what I mean when I was talking about a concept. So then you bring the pitch back to the group. So this is an example of what this looks like, right? This is called a creative brief. And just quickly, a creative brief often in agency land is like what the team brings to the creative team to make something. And I've just used that term here for my own because I think it's clear. But this is for the Key to Oregon. So here was our audience, Oregonians who are willing to step forward as individuals to help their families, communities, and state move forward. I didn't put them all in here in the interest of time. These are some of the descriptors we came up with, right? And the descriptors of how you want your audience to feel when they encounter your campaign. We want them to feel excited and empowered and proud and inspired and motivated. And then these were some of the considerations I had in my head, that this was a campaign that was for all of Oregonians, and it needed to resonate with them, from Portland's urban center to our rural counties, all across the state. The creative concept then, this is my explanation of my creative thinking, that I wanted to use a graphic suggestion of being inside something and seeing aspirationally to the outside. You can imagine what it's, you've all lived it, right? Being in your home during quarantine, and then what it's like to want to have the state moving again. So I explain all of the things here that are behind my creative concept. This is my mood board. I made some mistakes here that I'm going to talk about at the end, but I was inspired by World War II Agitprop posters and our national parks posters that you're used to seeing. And that's what that looked like. This is like my initial sketch of the campaign itself. You know, like you can see here on my pad, my big pad with my Sharpie, is what I was thinking. And then this is our art director, what he put together for the campaign, that you are the key to opening Oregon stores. And so you can see we had our strategy, our data, our goals. We had the creative discovery where we listened to all of the people that came to talk about the study and what it needed to do. I took that away, did my mood board, did some thinking, creatively brought that concept to my art director, and he made it into real life. This is the application. This is what we presented. And then this is an example of what it would look like in a different county. We knew from our data that localization here was extremely important, that people are more concerned about their own extended families and about their counties than they are about the state or about the nation, or even themselves as individuals. They're more concerned about their family and their community. So we knew that this had to be hyper local. So what happened is we had our community engagement liaisons solicit feedback from their community partners, and they did it via spreadsheet, which is not the best thing, but that's what we had for the creative concept. We gave them the deck with all the explanation. Then I had to present the concept to my team and the project lead on Wednesday morning. That afternoon, we had to present to the core team and the study committee. They approved it. 15 minutes later, they said, we need you to present to the governor. So we presented to the governor. We got an okay on the concept, and we had to be ready for our press conference on Friday morning. So you can see it went really, really fast. This is our president, Dr. Jacobs, who's wonderful, and his LSA interpreter, ASL interpreter in the background there. And you can see the artwork. So now when you talk about implementation plan, and an implementation plan is you have your data, your strategy, your goals. You get your creative concept together from the discovery, it just feeds it. And then the implementation plan is how do we take that creative concept and put it into the world? What does that look like? This is a part where oftentimes campaigns can fall down. I've noticed that it's not well thought through. So the way that we think about this in our team is that we have our infrastructure. So we have our website, we have our social media channels, whatever happens to be, right? The supporting technology that allows things to exist. And then we have our analytics, that who's tracking success. And then we have the content itself. And then those are distributed through paid, owned, and earned channels. I'm going to talk a little bit more about that. So the first thing we do then is start with our content pillar. right here. And a content pillar is your big piece of content, right? And in our case, it was the FAQs. We knew that people were going to have a lot of questions about this study. What are you doing with my privacy? How long do I have to participate? What does it mean? What do I get in return? Do I get a test? How invasive is this? What does it look like? Can I use my own thermometer? So our FAQs were based on our press release from the beginning, were simplified, and then we translated everything because we knew that there were disparities, especially in our Latinx communities, into Spanish. So these were our content pillars. Then you determine the channels. So we know that our paid channel is traditional advertising, TV and video and print ads. OOH means out of home, like billboards and bus stations and bus benches and that sort of thing. And then we have pay-per-click ads and display ads. Those are those little digital ads that you see in your channels when you're on a website, that sort of thing. The website owned is the things that you have control over, your website, your blogs, your email. And I put social media in parentheses because technically we don't own our own social channels, right? But we do determine their content. So it's kind of in a funny middle ground. And then earned is what you get through relationships with reporters or that sort of thing too, right? Or influencers, people sharing your social content, you earn that. So think through all of those channels. You have your content pillar, and then that content pillar is broken into pieces for each, whichever of these channels you're going to use. So for example, we did one larger video, and I'm going to talk about the translation here in a minute for Spanish speakers. We did a video that was about 2 minutes, and then we cut that video down into tiny little pieces that could be used in social that were like 6 seconds long. Then we did these fact sheets, which I realize have too much copy on them, but that's another thing I'll get to, both in English and Spanish. We did social media posts. We did graphics that could be used in social and on our website that were hopefully nice and clear. And we also created different localized artwork we split Oregon up into a certain number of counties or regions, and then created specific artwork for those regions so that it felt hyper-local. And you can see here we sent out these kind of save the datey postcards and letters with invitations to apply. And it was featured in a lot of news coverage. This is an example of an article from Portland Monthly. And we created this community outreach toolkit for our community outreach liaisons, where they had fact sheets, email templates, infographics, zip code data, artwork and recruitment communication, social media, PowerPoints, videos. There were a lot there that our liaisons could take out for their contacts in the community to share and help explain reasoning and that sort of thing. Once this has happened, it's really important to revisit your campaign once it's out in the world and then adapt. And so what we then do is determine some check-in timelines. We know this is a 3-month campaign. Well, let's check in after a month and see how we're doing, and let's check in after another month, right? Whatever is appropriate, and then schedule those meetings, get them on the calendar. Bring your data to those meetings. How are we performing? What's working? What isn't working? And also fulfill the promise of that collaboration. So there's people who joined in the discovery sessions, they should be at the creative pitch, and then they should be able to give feedback on an ongoing way. You ask for their time and their efforts, so they should be included throughout the rest of the process. If they have, and they will often have important ties to the audience that will give you feedback you maybe aren't going to get in another way. So then we keep doing what's working, stop what isn't doing, and then redistribute resources appropriately. And I know that sounds basic, but oftentimes this step isn't taken. And, with social media advertising, for example, $50 taken from one place and put into another can make a big difference. So these are some of the metrics we would use, right? These are our key study pages. This is from April to the beginning of June. And this is us getting an idea of what are people reading? What questions matter to them? What are they looking at the most? And then what are they doing on those pages? This is an example of some metrics that we're seeing from our social ads, right? The region, so the reach from our regions, we can look at all the numbers. These are Facebook ads in particular. And then what messages are resonating? And the interesting thing on these is that it was the hyper-local county-focused messages that people saw the most and were reacted to the most. We have since paused our Facebook ads for the month of July. We're joining the boycott of Facebook and have let them know why that is, even though it's an important tool for us for recruitment. But we disagree with the decisions being made by Facebook leadership. So this is in question at the moment. Okay, I want to talk really quickly. Oh shoot, I'm sorry, we're moving so far. About some mistakes that were made, and then I'll leave time for questions. The study was then accused of racial bias, and this was totally warranted. There was a lot of discussion about involving BIPOC communities that did not happen. That was lip service, and I will let you read more about it. But some of the things that were particularly awful to me, that I felt sick to my stomach about when I realized were just mistakes that were made. Using mail to communicate with people in and of itself is problematic, said one of the medical director of North by Northeast. And she lists those reasons why. She said that they're worried that the racial data that we were using to identify areas with large communities of color would be outdated. We were hoping to, we established some listening sessions, and those, of course, were not implemented and conducted in a way that was actually inclusive. And this quote to me was really important. It's very typical of white people in power to make decisions about what they're going to do and how they're going to do it, and then reach out to extract whatever data or information they can from people of color so they can say there's some sort of equitable lens or strategy in place. So there were a lot of learnings and a lot of team discussion. There's over 130 people working on this on the OHSU side, and basically put a pause on the study and said, we have to start over. So equity and inclusion are not boxes to check. We knew that there is systemic racism present in medical research, and that we have to make anti-racist efforts to change those policies and the way that those things are conducted. Trust built during a 2-hour discovery session is not going to sustain an effort. It's those long-term investments that will. We needed to slow down. The translation you saw for Spanish, there was some disagreement between a couple of our translators about which way we wanted to position the way a key is talked about. We had a really lengthy conversation about it, chose a different way of saying it, and then there was a mistake made, and the postcards all went to the printer with the wrong translation, which was pretty awful, and it was a huge expense, so we couldn't reprint. And so that was a problem because we didn't have someone who was a Spanish speaker on our actual team. There was not clear sense of roles. Our literacy levels kept creeping up and up because we had scientists who were used to talking about things at a certain level, so we had to keep asking and asking and asking. We're still having to keep asking to bring those literacy levels down. And so we're basically starting over and trying to take the lessons that we did not apply the first time and apply them for the second time to make sure that people are included in the way that they should be in order to have a study that is really meant to help our communities in the way it needs to. And I'm sorry, we moved so fast and I took questions in the middle there, so that made us a little bit slower. Kelly and Mario, should I keep answering questions, or what should I do? If people want to stay, or do we, I don't know if they can talk.
Yeah, you can go ahead and continue. You have 10 more minutes.
Oh, okay. All right. I appreciate everybody's time if you need to drop off, but these are such good questions. Okay. Abu was asking, how much detail do you need to go into for the audience section? It seems fairly broad. It is broad. You start broad, and then the facilitator really digs into the nuance. So somebody might say, well, our audience is students. And then you say, well, tell me more about those students. Where are they coming from? What are they interested in? What are their questions they ask you the most? What are their biggest hurdles? What's hardest for them? You know, that sort of thing. Ask a lot of questions. You start really broad and then you dig deep. And everyone will kind of laugh and, you know, say things really broadly, and then they'll get into the, Kristen's asking, what were the size and makeup of the creative team that supported this project? It was myself, one designer, and one writer. I did the videos myself, that sort of thing. We didn't have really a lot of budget. And then someone's saying, I saw Spanish on your material. Does your organization have Spanish speakers? So we have interpreters on staff, but we do not have translators, and our translators are contract. And so that was really something we learned was a problem, because it took a lot of time to have the Spanish in place. We wanted everything launched at the same time. And so that's something we're addressing now and hoping to get some actual FTEs for Spanish translation and not just interpretation, that shift. Ibuwa says, not a question, but that second point about how gentrification means that racial data on residents in an area will become outdated pretty quickly is important. I agree. And especially important, in Portland, we know it's a huge problem. Someone saying, who is at fault for the study criticisms? How do you recommend not taking it personally? I think we were all at fault in our own particular ways. And I did take it personally in the sense that I think it's important we own those mistakes and talk about the systemic racism that fostered them in order to have them not happen again. I know we had someone say like, well, we've done so much work, we're all exhausted, you know, and we all, I showed you what we had done before this and we were all really burnt out, but that's not an excuse. There are best practices in place for this that could have been followed. So I hope we took it personally, frankly, and then just saw how can we change it and make it better. Douglas, what was the slowing of COVID-19 cases the ultimate health outcome? Yes. So what happens is we want to enroll 100,000 randomly selected Oregonians. They track their symptoms. They get randomly selected for tests, and then OHA takes over when there is an outbreak, and they do contact tracing, and that's meant to let us see where hotspots are happening and shut them down quickly. And how could you tie those outcomes data to your intervention? So that was where the data you see that we pulled from our performance was important. And then I have that in the study documentation, and I'm happy to send that to you after the session. That's a good question. Let's see. And then people are responding to the things that we need to do better. Did we pilot the materials with representatives across the populations? All we did was that Excel spreadsheet where we had our community liaisons give us opportunity for feedback. It was not enough. I'm just gonna be really honest about that. And our creative discovery, because it was scheduled for the next day for 2 hours, we did not have the representation that we should have. It was a mistake. Our literacy levels, we try and keep between 5th and 8th grade. I will tell you that some of the text we are getting is at 16th grade level. And so it has been an ask over and over and over again, especially, you know, some of our communicators are used to speaking to government officials or whatever at a much higher level, referring providers, and to bring that down is a constant vigilance. So strategies for introducing the discovery to teams that don't understand approaching an initiative this way is I usually say we're going to do something new and it might feel uncomfortable, but these are the reasons why we do it, and to build consensus, et cetera, and by the end they get it. Like I said, it usually takes about half an hour for people who aren't used to it to warm up, but then the mood, people get it and they start to participate. Someone's saying, as a user experience researcher, I'm wondering if extreme users should become the rule for inclusive research participants in studies going forward. There are quite a few migrant farmers in Oregon, so having the language translation process need will be ongoing during COVID-19 and definitely to intentionally set the new normal. Yes, I think that's correct. And I think those relationships have to be in place before we do discoveries. So part of it, right, is shaking up the whole structure of the way that we conduct science, so that we're not trying to cobble together something at the last minute, I think is our biggest learning. It just is, it's false collaboration, and to my mind, in that sense. And then someone's saying, talking about the criticism, if there might be some typical ways of working that might cover up blind spots and invite bias. Yes, absolutely. I think moving forward quickly is a big part of this problem. I think moving forward quickly means that you don't take that time to interrogate the biases that might be present and affecting the work. That, to me, was the biggest thing. Having leadership that understands what those biases are and being vigilant about that is really important as well. I know at one point someone said during one of the listening sessions that this is a gold standard of a study. Well, that's not true. If traditional medical research is grown out of a racist system, then it can't be a gold standard and it has to be changed. So the way we think about things traditionally has to change. And then she's saying, Alex, are we planning to start over from scratch or just retool our existing campaign? We will just retool. We're going to do a whole new discovery. And if it comes out of that the way we did it the first time was wrong, then I think we need to rethink. So we'll see what comes out of this discovery session. Let's see. Oh, my bookshelf. Go for it. It's really fun. It's really calming. And then, do I have suggestions for boiling down dense pieces of information into the fewest, most simple words? Yes. Just take it all out. Some ways I say is explain it to like you're explaining it to a 12-year-old or something like that. You know, it's hard to do this for providers who are used to working at a really high level. So that's one thing that I'll say to them very often is like, explain it like you're going to say it to your son. How would you say it to him? And, you know, he's 8. Tell them what you do. And that helps them lower it a little bit. More and more of our providers are familiar with health literacy and are able to do it. So that's really encouraging. What do we consider the most crucial audience elements? Oh, you know, it really depends on the campaign. Age and gender, for sure, you want a wide variety of people. For me, that's the most important thing, that if you bring all leadership into a room and they don't get how work happens every day, or they don't actually go out into the community and see people, that is not going to be an effective discovery. If you don't have people in the room, for example, we did one with some of our moms who their children are having cardiac surgery. That was revelatory to me. So many of the things that I would have thought I would do we were putting together a pre-surgery booklet. I made all these assumptions that were totally wrong about what they would want. So having the audience in the room makes such a difference. Okay, thank you so much for joining me. That went super fast. I appreciate all of your really thoughtful questions. You've made me think, and I can't wait to visit some of these resources. Carol's asking about culturally sensitive material and not just translation. Yes, that is another place where I feel like we did not do a good job, and that will be revisited. Someone's posting a TED Talk, Judy, thank you. Is there a larger state level effort for health literacy? Oregon, OHA is actually pretty awesome at this. I think statewide we could do a better job of collaborating. Someone just said that was fun. Oh, that's so great. Let's see, it seems that the conversation with empowering providers to understand and do health literacy better is an ongoing one. Oh yeah, that's what we just answered, correct. Okay, thank you so much. I hope you enjoy the rest of the conference. I know the rest of the speakers are wonderful, and yes, the PowerPoint will be available. And I was gonna tell you my email address is here. I forgot those last 2 slides, but you're welcome to contact me. I would love to hear more of your ideas and your thoughts. Thanks so much, everyone.